symptomatic floaters. So floaters is one of the most common presenting complaint, and persistent and symptomatic floaters can cause a significant quality of life loss in the patient. So here we study the safety and efficacy of 23 gauge sutureless vitrectomy in symptomatic floaters in pseudophakic eyes. We included long-term symptomatic patients had given informed consent, and we excluded those patients who had other systemic or retinal pathologies. So the technique was a core vitrectomy with removal up to vitreous base. In those cases, PVD was not there and induction of PVD was done, and at the end, extensive search for retinal breaks was performed. There was up to an 18 months follow-up. The mean age was up to 63 years, more number of women than men, and PVD was one of the most important etiologies, and asteroid hallucis was another etiologies. So the mean visual acuity improved from 618 to 69 in our patients. So there was a good improvement in visual acuity. The quality of life survey also showed good improvement, with almost 96% patients showing satisfaction and 85% patients experiencing a complete success. 80% of our patients had completed the survey. The complications were presence of a retinal tear, but not in a patient whom PVD was induced. So retinal tear was present in a patient who had already a complete PVD, but it was an iatrogenic retinal break. So 2% had an iatrogenic retinal break. Transient complications like CME and vitreous haze were present in one eye and two eye respectively. However, both had complete resolution and a good improvement in visual acuity. None had RD post-op or end-off or choroidal detachment or hypotony. So our study, wherein we did a sutureless vitrectomy, showed a good decrease in the symptoms for the patient, that is improved quality of life. In this, we had a sutureless vitrectomy, because of which the surgical time was less, post-op inflammation was less, and hence recovery was quite rapid. So statistically significant improvement in visual acuity was present, and all our patients had initially impaired quality of life with improvement in the quality. There were low complication rates. Only one patient had retinal tear, and which was comparable, and there was no difference in retinal tear formation in those who had a PVD previously and did not have a PVD. So in all, sutureless vitrectomy in those who are symptomatic and who have been given a chance, that is, we waited for the patients for up to almost an year or so before we actually intervened surgically, had a high satisfaction. There is a limit. There are limitations to this, because there can be a selection bias, because we were this was not a randomized controlled trial. Limited patient population, that is small size, and difficulty in determining the presence or absence of PVD. The patients in this study underwent a survey many months after the procedure, and so recall bias can be an important thing. So patients with an active lifestyle who had a poor quality of life can be considered as ideal patients. As vitreoretinal specialists, we should give them an option to undergo treatment for PVD, because we many times just ignore PVD in our OPD and tell them that come again later. Thank you.
And do you counsel them about the risk of retinal detachment?
Yes, we counsel. We wait for an year before we actually intervene. We wait. We ask them, don't undergo operation as a first choice, but if anyone is actually impaired too much, especially if the floater is coming in their field of vision, if their visual acuity is getting affected, then only we intervened in this case.
Thank you.